Hello, thank you for joining us. My name is Dana Cooper, and I'm the Executive Director for the Nurse Practitioners Association of Ontario, or NPAO. We are celebrating nurse practitioners in Ontario and the wide-ranging and valuable contributions they make to healthcare every day by meeting some of our nurse practitioners and getting an introduction as to what they do and where they do it. Today, we are talking with Andrea Logan. Andrea is the chair of the NPAO Pediatric Community of Practice. Welcome, Andrea.
Thank you. I'm actually a co-chair. I do have a co-chair named Sarah, so I just want to recognize her as well because she's put a lot of work into this as well.
Great. Thank you for doing that. Andrea, why don't you provide us a brief introduction to a description of yourself, your years of experience, and your current work?
Absolutely. So I'm Andrea Logan. I am a pediatric nurse practitioner. I graduated in 2014 from U of T. I'm actually in the process of dual certifying. I completed my primary care NP last year, but COVID had different plans for me, so the exam has not been written. But I have been a nurse for 20 years, and I have been a nurse practitioner since 2014. I have worked first in sickle cell, nephrotic syndrome, and have now moved into eating disorders. So I have been a eating disorder nurse practitioner in Simcoe, Muskoka now for the past almost 3 years now. And my main location is Aurelia Soldiers Memorial Hospital, but I also work out of Royal Victoria Hospital where I'm employed.
Terrific. And just for those that don't know, there are 3 specialties to the nurse practitioner profession that are recognized by the regulators: pediatric, primary care, and adult. So there. Tell me about the work of the pediatric community of practice, and what do you hope to achieve?
Yeah, so we just are getting going on this. We are just getting our first couple of meetings put together. I started it initially, requested it because I felt that we needed more of a presence in the pediatric world in NPAO. And the best way to do that would be to get a community of practice with like minds to identify where we wanted to develop more in our pediatric roles and how we could support each other as a community. Shortly after I started and we had our first meeting, Sarah joined in with me and also became a co-chair to help me with the ever-changing needs of our environment right now.
So are there trends that you see in pediatric healthcare? You mentioned the eating disorder, but that concern or surprise you right now?
I think there's a lot of different trends. Eating disorders absolutely has had a 300% increase. And if you look at any of the news right now, it's making clear headways. The government has provided, from my understanding, some more funding coming down at some point. Not sure exactly where that will equate to. Our wait lists, our admission criteria has all gone up. But in addition to that, also the mental health component. So pediatric mental health has really gone on the rise. A lot of our eating disorder patients are much more complex now. They not just a straight up anorexia nervosa. It's a child with anorexia nervosa who also is having mental health difficulties, who may also have suicidal ideations and self-harming behavior and so on and so forth, more so than they did in the past. A rise in how acute pediatric patients are coming in as well. And then we're all planning for a surge in just respiratory illnesses this fall after being out of school for a year and a half and away from all the little germs that come out. We do know that there are surge plans in place right now outside of my own practice of just illnesses and what that's going to look like for our pediatrics.
Did COVID have a big impact on your patient population?
Yeah, absolutely. So to give perspective, in 2019 and 2020, we maybe admitted in my one hospital 11 patients a year. And this year already, we're not even at the end of the year, and we've admitted over 40 kids into our hospital just for eating disorders alone. There's also an increase in mental health admissions, and that's more where my practice is right now. But I do know that from our pediatrician colleagues in the hospitals that they've also been working on surge planning for more impacts around RSV and illnesses, which again is part of the COVID impact because these kids were out and now are coming back. But COVID took away their control, took away their interactions with other kids, change their whole lives essentially, put them into online environments when some kids don't do well in online, and increase social media use. And the increase in social media increase then in how they looked at themselves, their self-esteem, their mental health, and lots of challenges going on too in the social media world.
Yeah, no doubt has tremendous effect, particularly on that population. So there's practitioners that work with primary pediatric patients. Do they typically work in a specific location, or are they spread across the spectrum of healthcare?
Yeah, as of right now, most pediatric nurse practitioners work in the hospital, so in acute care settings. However, many of us had our training in more of a primary care pediatric lens. And I know that one of the reasons we also created the community practice was to look at how could pediatric NPs get more involved in community practice and not just in acute care hospital, whether it's preventative care, assisting with kids who may not necessarily need an emergency visit but had no other place to go. And also there's many kids who aren't attached necessarily to any physician or nurse practitioner in the community. So there's lots of expanse and room for growth. But at this time, I would say the majority of pediatric nurse practitioners are hospital based.
Did you see a move to Ontario Health Teams? Will that change anything? Or?
I really hope so. I don't know, to be honest. That's a really good question. And it's something that I'm hoping in our pediatric NP community practice meetings, we'll be able to discuss and see how can we contribute further in the grand scheme of healthcare and the transitions that healthcare is going through so often right now.
Yeah, neat. So there's been some talk by the nursing regulator organizations in Canada about removing specializations from the nurse practitioner regulatory nursing category. Do you have any comments on that?
Yeah, I think that it's a really interesting perspective. And I do feel that there is absolutely some nervousness, some questions going around, and it is something absolutely that has been brought up in our community of practice and something that we are looking to and trying to gain more answers on as a pediatric specialty NP. What does that mean for us moving forward? And I think it's another reason why we felt the community practice was so important right now. And we've also reached out to the community of practice group as well to communicate, because at the bottom of everything, every NP is trained in how to assess, how to diagnose, how to interpret diagnostics. And so it just means expanding our practice into a different population. And looking just in my own practice, moving from sickle cell to eating disorders, it's a huge transition in my knowledge and my skill sets. But at the bottom, if you take what we've learned, we're hoping that there will be a way that we can be grandfathered in with some extra supports to help make that transition, and that it will be a fluid one and fortify the nurse practitioner role, making it look more standard of care, and help us move forward as, again, the changing landscape is showing us needs to happen.
Right. So right now, the pediatric community of practice is encouraging people to sign up and join the community of practice in that.
Yeah, so we had started right before COVID. Lots of before COVID things in this conversation, but we started right before COVID, and unfortunately, all of our roles got moved around. People were being redeployed, lots of changes in practices happening constantly. It was really difficult to keep up. So we've kind of reignited at the end of the summer. We were going to start starting the summer, but Sarah and I felt we may not get a lot of people during vacation time after a nice long COVID lapse. So we started in September, had a couple of meetings already, but are really looking to increase membership and really get our community going. And we will be posting out meeting minutes from the last meeting shortly, and also future meeting times, and hoping to meet some more NPs in our community.
Great. And they can join the pediatric community practice by contacting NPAO?
Yes. Yeah. NPAO, you can also reach out to myself or Sarah, the two co-chairs, if you have any questions. We are very eager to get this going and very eager to get the pediatric side of NP world up and moving.
And you can find that information on the npao.org website. So thank you very much, Andrea, for highlighting, the work of nurse practitioners with pediatric patients. Another area where nurse practitioners work, just to, again, highlight their diversity or their flexibility in all the different areas that they practice. And this is another one that's obviously very important. But one last thing, just as we're celebrating nurse practitioners, what makes you proud to be an NP?
I think there's a lot of things I'm proud, but the bottom line is one of my goals was to help people and to make people maybe not be able to cure them, but make them feel better about the care that they're getting. And one of the really big perks about being a nurse practitioner is I always hear from friends, family, as well as patients that we have that ability to spend that little extra time and we go that little extra mile to look at the whole person. And I think that's what makes it so special for me. And being a nurse practitioner allows me to be a nurse, but continue to challenge myself every day with new knowledge and new experiences and never knowing what I'm going to get one day to the next.
Yeah, we refer to that as the unique promise of nurse practitioners, with the wide-ranging scope of practice, the compassionate, holistic care, the ability to diagnose, treat, prescribe. It is unique to the nurse practitioner profession.
Yeah,
Thank you very much, Andrea. Happy Nurse Practitioners Week.
Thank you, and to everyone out there, happy Nurse Practitioner Week. I know we don't always necessarily get that Nurse Practitioner Week recognition, but I want everyone to know that I'm proud of everyone that I work with, and I'm proud to be an NP.
That's wonderful. Thanks again, Andrea.
Thank you.